Well, good morning, everybody, and thank you for joining us. My name is Jason Lotzer, and I'll be hosting today's webinar. We have a great attendance today, seeing over 120 people joining us online today. So thanks for taking a little time, carving out an hour of your day to join us on behalf of Blue Cross. Today's webinar, we're going to be talking about post-pandemic mental health. And over the next 45 minutes or so, we'll talk about how this has quickly become one of the #1 challenges in the workplace today. Very important topic, and we have some great presenters today to share some great information with you. A few housekeeping items before we get started. Everybody, you're going to be on mute during the webinar, but you'll be able to ask questions at any time. So if you look at the GoToWebinar panel, you can type a question in the questions tab, and we'll try to answer them as they come in. We are live, so with this many people joining us, listeners today, we'll try to get to them as many as possible. So feel free to ask them as we go through the content. It's easier to ask the questions as we go sometimes, but we will have a Q&A at the end as well. We do have an hour scheduled, so we'll try to get through that and leave some time for questions at the end here. With that, I'd like to introduce Chris Kalesa, who's our Director of Sales at Blue Cross Blue Shield, to give a little intro on today's webinar. Chris, are you there?
You bet. Thank you, Jason. I'm very happy to kick this off. So on behalf of our sales and marketing staff, I'd like to welcome you all to our webinar today, where our focus is the mental health post-pandemic. We've moved from a worldwide pandemic and directly into a nationwide mental health crisis. What does that have to do with your organization, though? As it turns out, plenty. Mental health exhaustion has devastating effects both on your employees and your organization's bottom line. And it's one of the biggest threats to employee health, productivity, and engagement. The situation is dire, but is certainly not hopeless. Jim Harder, the Gallup organization's chief workplace scientist, says organizations are in a unique position to simultaneously perform financially and improve employees' lives. In the next hour, my colleagues from the wellness team will talk about ways to do just that, using resources already available to you. So let's get started, Jason. Back to you.
Perfect. Thank you for that, Chris. I'd like to talk a little bit about our presenters today. We have Pete Seljavold, who you might know as the leader of Worksite Wellness, Jacinta Riedinger, who is our manager of Blue Cross Blue Shield North Dakota Wellness Programs. And of course, you just heard from Chris Kalesa, our Director of Sales. So thank you all for joining us today as we go through this. So in addition to that, we'll go through the agenda for today. We're going to talk about the mental health crisis at a top level and what it's identified as. Big things like recognizing it in your workplace, what those watch-outs are and how to look out for it with employees. Then we're going to talk about proactive responses, what you can do as listeners, managers, to respond to those needs within the workplace. And then toward the end, Pete and Jacinta will talk a little bit more about tools and resources that Blue Cross Blue Shield of North Dakota have available to you as employers, listeners, managers, to help address the mental health crisis. So we're seeing this, swelling mental health issue in our country. Some people are even labeling it as a crisis. And I don't think there's any doubt about that, considering what we've been through in the last year and a half. So Pete, can you put some data around what we're seeing here over the last year and a half?
Sure. Thanks, Jason. You're right. It absolutely is a crisis right now. Study after study tells us that the pandemic is impacting mental health not only in America, but around the world. For instance, a lot of recent studies have found that over 40% of people said their mental health has declined since the COVID-19 outbreak. And another study said the number of people who describe the state of their mental health as a 3 or less on a 10-point scale has actually doubled. And of course, we're all hearing workers are reporting much more anxiety and stress. Employees, there's a lot of reasons for this stress, but some of those include, paying medical bills, just simple exhaustion, isolation from loved ones. We're not able to do the things that we've normally been able to do, get together with friends and family. And then, of course, the fatigue from online work and remote work, that's taking a toll as well. And another study by Gallup, their latest mental health assessment said our mental health is as worse as it's been at any point in the last 2 decades.
So those are some staggering statistics, Pete. But when we were talking earlier, you mentioned mental health issues were on the rise for the last decade, but the pandemic really exacerbated or compounded the problem. Can you talk a little bit about how that's impacted this mental health crisis?
Yeah, as you can see by the slide up, mental health issues have been rising really since about 2010. And when the pandemic hit in 2020, there was a huge spike in anxiety, depression, substance abuse, and loneliness and so forth. So, you'd asked about, are we going to return to a normal anytime soon? I don't like to think of it as terms of returning to normal. I think of it in terms of a new normal or the next normal. A lot of people have said this isn't something that we're just simply going to bounce back from quickly. If you think about it, it's really been a challenging year for all of us this last year and a half of remote work, virtual meetings, limited social interactions, personal or family health issues. All of this is taking a toll. Several surveys, including those collected by the CDC, have shown substantial increases in self-reported behavioral health systems. According to one report, this was done in 2020, 31% of respondents reported symptoms of anxiety and depression. 13% reported are having started increased substance abuse. 26%, about a quarter of us, are reporting stress-related symptoms. And 11% have reported serious thoughts about suicide in the last 30 days. The interesting thing about this, these numbers are actually about double that we would have expected to see prior to the pandemic. And then on top of that, a new poll said about 43% of adults said the pandemic has had a serious impact on their mental health. And that's up from 37% in 2020, so a 5% increase.
Yeah, those are huge numbers, Pete. And I think, a lot of us have probably felt some of these responses through this whole thing. I mean, I think it's increased stress levels and anxiety for a lot of us in one case or another. So it's important to identify those. So can you you talk about it as employees, but can you talk a little deeper on, like the individual level, from an employee's perspective, Pete?
Yeah, absolutely. So, considering all that we've been through in the past 18 months or so, it's really no surprise that we're experiencing much more stress and anxiety than normal. The interesting thing is for some, the pandemic was a positive experience or kind of a non-event. It allowed them time to slow down, take a break, and some actually felt better that they had more control over their work-life balance. But for most of us, it has created more stress in our lives. And that's leading to increased levels of anxiety and depression, worsening of existing mental health issues, and increased drug abuse and addiction issues as well. We have to keep in mind that resiliency is really a finite resource, and people can only take so much stress before their mental health begins to suffer. So some things that happen to us individually, that prolonged stress can lead to high blood pressure, can lead to weight gain, heart disease, back and neck pain, and increased substance abuse as well. And, we have to remember that overcoming this kind of anxiety and kind of reacclimatizing ourselves to social situations, it's going to take time for a lot of people. So we need to extend some grace to everyone through this tough time.
Absolutely, Pete. All great points. So, I think you did a great job, Pete, there identifying, what the crisis is. So, and we know people are struggling in their personal lives. So can we take a deeper dive of how that translates into the workplace, Pete, and, recognizing those mental health issues in and around work, and our peers are, managers, everybody that's involved in the workplace. How do we recognize those issues?
Yeah, great question. We're all humans, so this affects us, and certainly it's going to affect how we perform at the workplace as well. The first thing is people are not really willing to admit that they're going to have issues. As a matter of fact, a recent article I read, more than half of employees are afraid to discuss their mental health issues with their boss. So it's really something that's not being readily discussed. But some signs that we might see, or some clues, are increased absenteeism or tardiness, decreased productivity or lack of quality work, particularly among skilled workers. And then also we're going to see some decreased employee engagement in their work. Maybe they're going to have some lack of interest, or they're just not doing things that they used to enjoy at work as well. You might also see some increased cynicism or sarcasm. All of a sudden somebody's developed a bad attitude. They're going to have lack of communications with their coworkers. They might be depleted or detached, stating that they're overwhelmed, or you see them withdrawing from their team. Also going to see some mood changes, might go from high to low, or increased irritability. Change in their sleeping habits. These can all be signs of mental health issues such as depression or anxiety. And over time, these can become very serious, leading to physical problems or even suicidal thoughts. And they're also signs of burnout, or they can lead to burnout.
Yeah, burnout's a word I've heard a lot over the last year. People reevaluating where they're at with everything. I used to think a little bit more like, burnout, I need a vacation, but, I think it's a little bit more than that, Pete, than I just need to take a few days off. Can you shed a little more light on that and from your perspective?
Yeah, I think what you stated, Jason, that's what a lot of people think, and that's what I think of when we think of burnout. And oftentimes a vacation or some time off can help, but you're right, it is much deeper than that. As a matter of fact, the World Health Organization included workplace burnout in its international classification of diseases. And here's how they identify it. It's an occupational phenomenon that leaves us feeling depleted, exhausted, unable to focus, and feeling cynical or detached from our jobs. And that classification was put there even before COVID hit. So now imagine when the pandemic hit, and on top of everything else we were dealing with, job insecurity, layoffs, furloughs, those types of things. For some people, this created financial distress. And then we had really a stream of stressful headlines around racial injustice and a tense political climate. And then all of a sudden, millions of people, they became full-time teachers overnight, helping their kids with homework and trying to do that on top of their job. And then isolation from friends and family. As I mentioned, we just weren't able to do the things that we're used to doing in our daily routine. And then add Zoom fatigue and adjusting to remote work. Those were all stressors. So, it shouldn't be really any surprise that our stress levels have reached these historic highs. And another recent study from, I think it was the journal Lancet, found that 1 in 5 COVID-19 patients developed a mental illness within 90 days of their recovery. So that's taking a toll as well. So really what we're seeing is this whole new category of burnout in people who generally considered themselves, pretty healthy and were able to cope with life very well. And then suddenly they were developing this overwhelming sense of exhaustion in their core outlook, and that was pretty hard to cope with. So, burnout does have real consequences for our health. What the researchers are seeing is people who had underlying chronic health conditions such as autoimmune conditions, high blood sugar, heart disease, migraine headaches, digestive issues, and so forth. The things that 60% of Americans are living with every day were getting worse.
Yeah, I mean, those are all things that, again, I think all of us have experienced some of these symptoms, and it's just been, a product of this last year, a lot of it. So, one, term coined, I think it was Ariana Huffington. It's been getting a lot of traction lately in the media about this phrase called the Great Resignation or the Great Awakening. We have an article pulled up here, and what is, in your mind, the Great Resignation?
Yeah, those both of those terms have been getting a lot of media attention. So if you watch the news or done any reading, you probably run across something that's addressed this. So those terms are really being used to describe this global phenomenon in which we're beginning to emerge from the pandemic, but a record number of people are quitting their jobs. In April alone, that amounted to about 4 million workers in the United States, or almost 3% of our workforce. And that's the highest rate since the year 2000.
Wow.
Another study out of Microsoft, they did a survey with their employees, and they showed a staggering 40% of their global workforce was considering leaving their jobs this year. And Prudential did a survey with their employees, and they found that if given a chance to retrain, 53% would take a new job in a new industry altogether. And most of these stories about why people are quitting, they're citing burnout as one of the biggest reasons. So what's happening is, people are really taking some time and thought and really reevaluating their relationship with their job, and perhaps even questioning, is this worth it? And one of the ways that people deal with burnout is by switching employers. So what the pandemic did, it really gave us some time, a lot of time to think about what we value, the place that we work, what makes us thrive, and which part of the pandemic we want to take with us into our post-pandemic future, and which parts we want to leave behind.
Yeah, those are all great points. And I think, it kind of brings us to our next section here. Um, that it is a threat to businesses, and how can we retain employees, but how can we proactively be looking for these and making sure that we're addressing these issues in the workplace to, retain employees that we've put a lot of time and effort into training. So let's shift gears to that a little bit and how we respond to this proactively. Jacinta, I'm going to kind of, bring you in here into the conversation a little bit, and, what can businesses do proactively, as leaders and listeners here, to address this?
Well, thank you, Jason, and good morning, everyone. I guess to start off with, I would say one thing businesses can immediately do is take an inventory of all the resources that are available to their employees and make them easy to find. We recently did that here at Blue Cross Blue Shield North Dakota when we were rolling out a new employee intranet, and it was amazing how difficult it was to find some of the programs, and they were sort of hidden in different places on our intranet. And so just sort of making those programs front and center with no digging required so that employees could easily access them. And doing so will not only help your employees, but also your business, because we know that mental health efforts equal loyal employees. And actually 66% of employees say that they felt better about their employer after using the mental health benefits that were available to them.
Yeah, that's a huge number when you look at that overall. So if we look at it, what can listeners do from their organizational perspective, Jacinta?
Yeah, so I think the businesses can build on the inventory exercise that I just talked about to identify what they might already have in place and then what they might be missing from a benefit perspective. I know a lot of companies have been forced to reevaluate how they're interacting with their employees and perhaps offering new benefits or rethinking how they do business. For example, right now we're in the time of return to work, or in some variation of that, depending where you are, but people are even more anxious. And a 2020 Limeade Institute survey found that 77% of employees fear exposure to COVID upon returning to the office, 71% fear losing schedule flexibility, 68% of employees dread having to commute to work again, and 100% are feeling stressed about going back. So I think in response to some of these challenges that have been posed by the pandemic and return to work, employers are reporting that they have to start offering or looking at new benefits to support remote work and to help improve productivity. And so some of those new benefits might include, extending that option to work remotely, maybe indefinitely for some if that's what they prefer. The option of flexible scheduling, again, introducing sort of that idea of autonomy into our workday, and just the idea of having more autonomy lowers stress levels amongst employees. Regularly scheduled employee manager check-ins, and I'll certainly be diving into this topic a little bit later, but that is huge in helping employees manage their workloads, their mental health, and overall well-being. Supporting work issues such as adjusting to new responsibilities, and then also programs that offer referrals into behavioral health or substance abuse disorders.
Great. And I think, we'll dig into managers here a little bit, but I think, some of those on the last slide, if we're not able to offer some of those flexibility of remote work, I think it brings into, the limelight a little more how important managers are if we have to have in-person work. So this quote here, I think, is kind of a good lead-in just into where, author Laura Putnam says, every manager is either a roadblock or a multiplier of well-being. How important are managers at work when it comes to identifying and proactively addressing these mental health issues?
Yeah, well, managers are key, and according to Gallup, the manager alone likely accounts for 70% of the variance of their team members' engagement with both their work and their well-being. And this means that companies really need to clearly establish the manager's well-being responsibilities and equip them in their own role in the process. So I know I previously in the last slide talked about the manager team weekly touch points. So that can really be one of the manager's greatest tools in supporting their employees' mental health and engagement with work. In fact, intentionally checking in with each of your direct reports on a regular basis is more critical than ever. And according to ADP Research Institute, it can be as simple as asking 2 questions. What are you working on, and how can I help? And that alone can sort of help facilitate those conversations with your team and make sure that you're having those frequent touch points. Some other ways that you can influence the well-being of your teams, and specifically emotional well-being, are to focus on your employees' strengths and leverage those. We've seen a lot of research that shows that when employees are able to use their strengths every day, that they're thriving more overall in their well-being. And then just things like, as Pete talked about burnout, helping team members manage their work overloads and help them to reduce that. Another important piece is to be vulnerable yourself. So as Pete mentioned earlier, with more than half of employees being afraid to discuss their mental health issues with their boss, that's kind of a big staggering statistic. And, to kind of support that, a survey conducted by OnePoll on behalf of Learn to Live revealed that 62% of employees felt that their boss would judge them if they did request time off for mental health care. And 7 out of 10 would rather take an entire day off rather than just a few hours to avoid having to tell their supervisor why they're taking time off. And so as a leader, being open and honest about your mental health opens the door for your employees to do the same and feel comfortable talking about their mental health challenges. And then showing empathy with that, I think, goes a long way. And then I think the last thing that I'll just touch on is just the importance of promoting social connections and even friendships within your team, because we know that people who have at least 3 or 4 close friendships are healthier, they have higher well-being, and are more engaged with their jobs, in contrast to with those without close relationships, or just being in this pandemic over the last year where we're more isolated, that can lead to loneliness and depression. So
yeah, and I think those are all great points, Jacinta. I know at Blue Cross here we've implemented the Managers on the Move program, where I think it's getting to know those employees on a deeper level, and taking the time to just be aware of some of those signs, but more than just the passing in the hallway, how are you doing? Do you want to talk just a second about Managers on the Move and kind of some of those tools that you guys that we're doing?
Yeah, so it's really been a program that's focused on our leadership and really to develop them to do some of the things that I just talked about, to be able to really integrate those really human, authentic conversations and relationships with their team members by, simply doing the things that I talked about, helping team members leverage their strengths, being vulnerable, and just really facilitating relationships and friendships within their teams.
Yeah, that's great. Thanks, Jacinta. Can we talk about, a little bit about listening to your data, Jacinta? I mean, I think there's a lot of tools and data that's here that we can look at that are also telltale signs that we can take a look at.
Yeah, I know, Pete talked a lot about the national statistics and what we're seeing on a broader scale in terms of mental health and statistics, but I think there are many different data sources that can help us provide insight into how our employees are doing and maybe doing over a period of time. So a couple of different sources that are available. Obviously, claims data is a source that you might look to. And I think just speaking from our experience here, I know our book of business typically shows that depression is almost always in the top 3 of chronic conditions presented. And then even just HR data. So can we look at productivity, absenteeism, how well is the EAP program being utilized, those types of sources. And then annual engagement surveys can tell us a lot, particularly if there's open comments and ways that employees can kind of share feedback in an open and honest way. And so I think that leads into kind of my next point too, is just as equally as understanding the data is also just to create those channels for employees to be heard, whether that be focus groups or intentional discussions with their teams and departments.
Great, thanks, Jacinta. So, Pete, I'm gonna bring you back into the fold here, and we talk about culture, being so important and probably now more than ever. So, what about creating a culture of well-being and putting more of a focus on that?
Yeah, I think we're seeing a lot more organizations are trying to create a culture of well-being and adding programs and services to enhance what they already are doing in the well-being space. But at an organizational level, we're no longer in this why well-being world. We're really now into how well-being, how we can bring well-being into our organization. And the how, it's not really going to be about adding necessarily more perks, like ping pong tables or omelet bars. Those are all neat things, but it's really about introducing mental, emotional, and physical well-being policies and services to your employees. So we need to incorporate well-being and recharging practices into our work and into our lives. So we need to think beyond simply adding more time off. And we also need to do less of kind of one and done type programs or well-being interventions. And we need to stop thinking about recharging as simply a reward for working hard and burning out. We also need to really embed well-being into the fabric of our daily work experience. It becomes part of the culture. It's the way we do things here in our organization. It's great to see that companies are recognizing the importance of well-being and the dangers of burnout. But the truth is, people have been burning out for years. It's more than taking a week or two off here and there and then returning to work, feeling like you're overwhelmed and then getting burnt out again. According to one survey, 25% of workers said they forfeited paid time off in 2020. And a greater percentage feel that they're more burned out than they were a year ago. And about 60% said that they really needed an extended awaycation to unplug from work completely. I think we were into this mode where we were kind of on 24/7. It was just so easy to be connected and checking emails. Sometimes you just need to completely unplug.
Yeah, that's a good point, Pete. I think we look at an awaycation being at home, but now we're working at home, so there is no unplug anymore sometimes for some people. So
yeah, that there's pros and cons to that, and sometimes you just absolutely need to unplug and leave the phone and the laptop at home. And the great thing is, creating this culture of well-being, it's going to pay dividends to you in terms of retention, recruiting, and overall job satisfaction. As Jacinta mentioned, 66% of employees felt better about their employer after using their well-being benefits. And about 60% of job seekers said mental health benefits are going to factor into the selection of their next job.
Yeah, I think those are huge stats again, Pete. Thanks. So Jacinta, once we've started creating a culture of well-being, how can employers and people listening today drive engagement in well-being programs in their workplace?
Yeah, so certainly all the strategies that we've discussed so far are key in driving engagement in well-being programs and actually foundational when you think about having that culture in place in order to support those programs and a manager who is supportive and sort of leading their team in those efforts. But we also know that, as Pete mentioned, well-being is multidimensional, and so therefore engagement in all areas of well-being can have a positive impact on our emotional health. And so some additional ways that you can drive engagement in addition to what we've talked about so far would be to really engage the employees in that planning process. So, getting employees on board as advocates to shape and communicate the well-being philosophy, the tools and resources available, and how they'll benefit from participation. And the same goes for managers. We learn most from one another, and so featuring stories of both employee and manager experiences can be very impactful. Also just really communicating the program. I think if employees are left on their own to try to figure out how their wellness program works, how to find it, the benefits of participating, they're probably going to be less likely to participate. And so ongoing communication really drives ongoing interest, and the opposite is true. So no communication translates into no participation. So well-being programs, and particularly ones that focus on mental health, should really be front and center and talked about by the management team. And so that leads into kind of my final point here, and I know we've already spent a significant portion of the discussion on this today, but it's for good reason. Well-being and culture matter when it comes to mental health, and it's largely up to leaders, and especially middle management, to ensure that both become embedded into the fabric of business as usual. So, for example, if an employee sees their managers taking stretching breaks or, not responding to emails in the evenings and weekends, scheduling team meetings around wellness activities, those employees are more likely to take time for themselves and become more active participants in their own well-being. So as I stated earlier, managers who are open about their own mental health challenges with their employees will open the door for employees to feel more comfortable talking about their own mental health challenges. So it really does set the tone for their team, and we've kind of looked at it in the fact that each manager has the opportunity to create their own little oasis of well-being within their team.
Yeah, absolutely, Jacinta. I think that's really important. And again, just that sense of vulnerability in leading with the empathy, I think are huge points that you brought up earlier that I'd like to stress again that I think are really important when talking with employees.
Absolutely.
So we're going to shift gears here a little bit, and we talked about recognizing it and being proactive about it, but let's talk a little bit more about tools and resources available through with Blue Cross Blue Shield North Dakota. So I'd like to start with health coverage first. So Chris, if I could bring you back into the conversation, could you talk us through what's covered from a benefits package perspective from Blue Cross?
Oh, you bet. So the grid here might look familiar to many of you. It's just a snapshot from the benefit grid, just a general benefit grid. The behavioral health or mental health is, it's part of your employee's health plan, and it's covered under all the Blue Cross Blue Shield health plans here that we offer. These services are paid very similar to the other medical services one would seek, and it just depends upon the plan design that you might have. So it's, behavioral health is an umbrella term for, not only substance abuse disorders, but also mental health. So when they seek services related to any of those things. And employers and employees should refer to their certificate of insurance or summary plan description to confirm these benefits, or feel free to call into our member services number, and that's the phone number on the backside of their ID card, just for quick reference.
Perfect. Thanks, Chris. So Jacinta, outside of, the traditional covered benefits, what additional tools, resources does Blue Cross offer to, support mental health?
Great question. So, according to the same Learn to Live survey that I quoted earlier, 64% of Americans wish that they had more mental health care options available outside of traditional therapy, whether that's in person or virtually. And then additionally, 41% also said that they struggled to find the time to seek care. And so as a result of some of this and just, what we're seeing in the broader landscape, BCBNSD has really recognized an increased need to support the mental health of our members as a result of the pandemic and all that has come with it, and have therefore made some additional options available. So first, I'd like to talk about our partnership with Learn to Live, in which your employees have the opportunity to engage in life-changing digital programs and coaching to help master their emotional health. So these programs are based on proven fundamentals of cognitive behavioral therapy, which really focuses on understanding how the way we think impacts the way we act and ultimately impacts our behaviors. And actually, cognitive behavioral therapy is one of the most common forms of therapy used in office settings today. And Learn to Live counseling has benefited more than 3.5 million people nationally. Well-renowned organizations like Marie Claire, U.S. News, and the World Report, and others have reported using the program. And really, the key components, as you can see on the screen, are comprehensive clinical assessments, access to personalized clinician coaching, and then self-directed programs around common mental health topics like stress, anxiety, and worry, insomnia, substance abuse, depression, and more. And then you can find...
I was just going to say, you can find that at Learn to Live, but this is available free to everybody right now, is it not, Jacinta?
Yes, it's available to all of our members, both group and individual.
Yeah, so I think that's an important note that we've made that available to everybody. So it's definitely worth something. Check it out. Go to learntolive.com to find that. So let's talk a little bit about telehealth, Jacinta.
Yeah, so telehealth visits are also covered in your plan and are a great way to get care for dozens of routine medical conditions. But the reason we bring it up today is that telehealth is also a great way to get discreet and convenient medical care for mental health conditions and substance abuse issues. And your employees have a couple options when it comes to telehealth. Your regular provider may have digital care options, and so it's important to check directly with your provider organization to find out what they have available in terms of telehealth options. But another option is American Well, who is our partner for telehealth services. And so they've long been offering live, on-demand video visits from either a smartphone or a computer to really provide an additional avenue to access mental health services.
Perfect. So what about wellness programs like Healthy Blue? I know there's a lot inside of Healthy Blue, Jacinta.
Yeah. So for those of you who aren't familiar, Healthy Blue is an online wellness center that's available to all of our group and individual plan holders who've opted in to offer the program. But it's filled with tools that can help individuals manage their health. And I'll point out a few here that are specific to mental health. And the first one is really daily habit plans. And what these are is just really, they help encourage long-term behavior change by breaking down participants' goals into shorter, actionable steps. And so here are just kind of a couple of the daily habit plans programs that are available to support mental health. So coping with the blues, staying connected socially, keeping stress in check, managing work-life balance, and then also sleeping well, because we know the important role that sleep plays in our overall well-being and particularly our mental health.
Absolutely.
Another aspect of the program would be challenges. So we host a variety of challenges throughout the year on a number of different topics, but one in particular that is relevant to today's discussion is the Stress Less Challenge. And in this challenge, participants are encouraged to start small by doing at least one 5-minute stress relief activity each day.
Really easy, simple way to get started in it for sure.
Yep. And then finally, one of our latest additions has been a partnership with Beyond Well Solutions to provide podcasts that support mental health during the current crisis and beyond. So these podcasts focus on both COVID-19 and then also mental health topics, including techniques for coping, managing anxiety, and dealing with change in the workplace. So these are a great added benefit that have been recently rolled out.
Awesome. And speaking of podcasts, Pete, I know we've had a fun-filled year here with developing Blue Cross's first Be Wellcast that just launched recently. Do you want to tell listeners a little bit about what the Be Wellcast is and how they can get it?
Yeah, for sure. The Be Wellcast, it's a new Blue Cross sponsored podcast, and it's really about being your best self. And we recorded and launched the first season a little earlier this summer, so that's available to listen to right now. And that first season really focuses on all the different elements of well-being and this holistic approach to well-being that we're taking. We have a couple episodes specifically focused around emotional well-being. For instance, we did one with Dr. Corey Martin, and he really talked about, how do we take care of ourselves and how do we take care of others? And really brings up some great simple things we can do, like, expressing gratitude and naming 3 good things, those types of things that you can do right now. And for season 2, which we're going to be launching here a little later this fall, the entire season is going to be focused on mental health issues because it is such a timely topic. And like I said, that'll be released by year's end. You can find this podcast really wherever you find your favorite podcast. Just search for the Be Wellcast.
Yeah, so you can check those out. Everybody listening, you can go to Apple, Spotify, Google, any of those, and they're free to download. I think they're all of them are less than an hour, just a good listen on your way to work, and something you can definitely share with employees. And I think this next entire season, we're really excited to bring that to you guys. So considering that it's all around mental health and considering it's one of the biggest number one things that we're looking at this next year. So Pete, could you talk a little bit more about the other resources, maybe some other apps and things like that online that we can use?
Yeah, in addition to the podcast that I just talked about and the one Jacinta mentioned, there are literally dozens and dozens, or actually hundreds and hundreds of different free resources you can use. If you can download some apps on your phones, you can use things like Headspace and Calm. YouTube has literally thousands of different things you can listen to, like guided meditation, and something that I listen to, they have bedtime stories. So if you're having problems sleeping or want to relax at the end of the day, just plug in a bedtime story.
So you don't count sheep, Pete, you listen to bedtime stories. Well, that's great. So, again, I'd like to thank everybody for joining us. Pete, Jacinta, Chris, thank you all for the content you provided today. I think it's a great start. Overall, there's some really quick wins, I think, that we could have as listeners out there. I think putting that focus back on managers and just that vulnerability and leading with empathy, I think is a big thing, and connecting with our employees on a deeper level so they feel comfortable talking about mental health with us, I think is a huge first step. And we've had a few questions here. I think one of them was where can we access the podcast? Came up again. If you just search on iTunes, the Apple Store, Google Play for the Be Wellcast, all one word, you can pull that up and take a listen to any of those episodes. If anybody else has any questions, I encourage you to ask them now, because we are kind of reaching the end here and opening it up for Q&A, but I think we've got to most of them. Pete, Jacinta, is there anything you'd like to say in closing?
I would just like to thank everybody for their time. We really enjoy being able to do these webinars, and certainly as a follow-up to last week's summit is just being able to continue the conversation around well-being and engage with our business leaders on this topic.
Yeah, I would like to thank everybody too for listening, and hopefully you've got some new ideas, and I would encourage you to implement some of the things that we talked about, and take some of these steps to create that culture of well-being in your organization.
Yeah, I think those are important steps to take. And just so everybody knows, we did record today's webinar, so I think it's great content, and it's something that is worthy of sharing. So for those who couldn't make it or you'd like to share within your organization, there will be a follow-up email with the recorded webinar in there, so you guys can reference some of these tools and resources. Again, I'd like to thank everybody for joining us today, and everybody have a great afternoon and be well.